Okay, good afternoon, everyone. I have a preliminary statement to make. As a preliminary matter, this is Stephen Vigent, Chair of the Shrewsbury Board of Health. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dr. George Abraham.
Present.
Jenny Fishman.
Present.
Staff, when I call your name, please respond in the affirmative. Micah Blondeau.
Affirmative.
Julie Van Arsdalen. I don't think we have Julie, right?
Affirmative.
Oh, she is here. Okay, good. Carrie Stockwell.
Affirmative.
Karen Clark. Yep. Okay. John Wensky.
Affirmative.
We know Dr. Sawyer is not coming on. Dr. Maddie Castile.
Here.
And Dr. Michael Hirsch.
Here.
Okay, good afternoon. This open meeting of the Board of Health is being conducted remotely, consistent with Senate Bill 2475, signed into law by Governor Baker on June 16th, 2021. This meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. The legislation allows public bodies to meet entirely remotely, so long as reasonable public access is afforded, so that the public can follow along with the deliberations of the meeting. For this meeting, the Board of Health is convening by Google Meet, as posted on the town's website, identifying how the public may join in. Please be sure to press *6 to mute your device. This meeting will not feature public comment. And also, finally, each vote taken in this meeting will be conducted by roll call. Okay, as a notice, pursuant to Senate Bill 2475, signed into law by Governor Baker on June 16, 2021, suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 18, this meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. All meetings and hearings listed in the agenda will also be done through remote participation. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found at the town's website at www.shrewsburyma.gov/coronavirus. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. To listen to this meeting, dial 1-617-675-4444 and enter the following PIN, 740-529-491-6248 #, and please mute your device. The Board of Health will now consider the following agenda, and I'd like to call the meeting officially to order. The first item is to review and act on requiring face coverings in all indoor private common spaces in the workplace and indoor private spaces open to the public. I'd like to preface this by saying that this special meeting of the Board of Health is being called due to the impetus of the Worcester Division of Public Health sending a memo to all Alliance towns, basically generally advising them to adopt the 3 emergency orders that have been issued by the city of Worcester in regard to the control of the coronavirus, especially the control of the Delta variant. So at this time, I would ask if either Dr. Hirsch or Dr. Castile, if you have any information or presentation, to go ahead and do that.
So thank you, and I will show just a presentation, which I think probably all of you are very much aware. I'm going to start here, if I can go back here. And I'm just going to present some Shrewsbury data. But I do want to say that part of the whole PowerPoint is really to talk about the evidence behind, certainly about masking and the effects of what it does, whether it's the general population, schools, in lowering the numbers. In spite of the fact that you guys in Shrewsbury are doing fabulously in the sense that you have 76% of the community who've received the first dose, and 70% of the population is fully vaccinated. And when we look at the state of Massachusetts, 73.5 have received the first dose, so you guys are higher, and 66.4% are fully vaccinated at the state. So overall, doing better than the state. And when we look at the numbers from age by age, you can see that the numbers compare Shrewsbury here compared to Massachusetts. Your numbers are certainly much higher. And looking at, 16 to 12, across the board, I think 20 to 29 is where you're at 69. But looking across the board, 30 to 49, 50 to 64, the numbers are doing extremely well. And when we, again, looking, I think this is the same one, if I'm looking correctly. Yeah, so I'm going to move to this one. Just looking at the overall, just the cases that you've had in 0 to 9 age groups overall. You can see the numbers here, 496, 508. And so the numbers are here, the percent of cases for Shrewsbury. I think we all know that this is spread through droplets, whether we through breathing, through talking, through cough, is how we spread this coronavirus, and that this is the main piece of why masking is an important piece. And when we look at, when we put it on a petri dish, we could see what happens without a mask. And this is just bacteria, but you can see the bacteria here. And once they're masked, you can see that there is nothing on the petri dish. And we had done this talk just to basically talk about, the different data that exist for wearing masks, and from the different journals that have it, and looking at, in particular, looking at some of the outcomes of it. At 70%, mask wearing reduced the risk of infection by 70%. This article says that it reduced the risk of infection by 79%. This one reduced it by 77. So just it can, and it, I put them all together, and there's more that I'll show that actually talk about the effect of that. According to the CDC, upwards of 80% blockage has been achieved in human experiences that have measured blocking of all respiratory droplets. And then when we and so at least 10 studies have confirmed the benefits of universal masking and community level analysis. Also to note that a lot of these studies have also been done since 1918, when we had the last pandemic, and at which time people were wearing masks, and the effectiveness of masks were even shown during that time. But wearing masks has shown that new infections fall significantly, that it reduces mortality, it reduces hospitalizations, and it tripled the likelihood of stopping community transmission. And overall, they reduced the losses, so of up to 1 trillion, or about 5% of gross domestic product, by cutting down infection rates by wearing the mask. And then these are some data just showing when mask mandates come to be, that once the mask mandate is put into place, you can actually see that it starts leveling off, and ultimately decreasing. And this is without the mask. And the same here, mandatory masking decreased COVID-19 case rates, fatalities, and averts lockdowns. And so again, just with a 15% increase in masking, GDP savings were $1 trillion, or that 5% of GDP. But you can see that this is the period where they introduced the masking, and you can see the numbers, the cases starting to decrease. And the same thing for a fatality rate. You can see here that it also started to decrease. And these were all CDC reports. And so CDC also recommends universal indoor masking in K through 12. Schools without masking requirements were 3.5 times more likely to have COVID-19 outbreaks compared with schools that started the year with mask requirements. So this particular one is also showing, it's the same, it's a CDC study of 520 counties found that COVID-19 cases rates during the school year were smaller in counties with masks. So those that are the dark blue are the counties with the mask who didn't have mask, and the light blue are the counties with that had the masking in place. And you can see that the transmission rate was a lot lower in those cases than in the cases where there were no masking. And let me see if I can just go this way. And this is just, again, it was a lot of it is to show that all the data that actually exists on regarding masking. And again, we can go on, and there are numerous. And then I just wanted to at least say that, you know, again, we've been doing this since 1918, where we've had masks in place. At that time, we had 675,000 deaths. We have certainly surpassed that in the 700,000 deaths right now. And those same issues with masking, of whether to wear a mask or not, occurred back in 1918. And I always hope that we learn from the past of what we do today. And again, those same issues of anti-masking or not wanting to mask was certainly something that was there. I think for, I don't know if I can, let me see. I think our thought process about all of this is that, you know, back in the, I'm thinking of when this year, somewhere around March or April, that we saw that the numbers were starting to come down. And we thought we were fine and people were getting vaccinated. We quickly stopped, and we gave up our mask, and we started moving into the community and trying to go back to what we call, or what people were thinking is back to normal. And the reality is we didn't even really pay attention in that sense to noting that the Delta virus was here, and that the Delta virus had significant effect on our community. The thought process is to continue being able to mask, even though numbers are good for Shrewsbury, thinking that how we should handle a pandemic shouldn't be by neighborhood or by town. It truly should be a statewide issue till numbers are doing better throughout the state. And so that's the way I think we should look at it. That's the way we should handle pandemics in the future. It should not be done in a town by town. And, you know, those are some of I think the mistakes that we have done in the past, and we need to look forward and really think about how we do this differently. I don't think we're moving. I don't know what the new normal is, but we're not moving out of there quickly, and we need to just continue this process until we can actually see these numbers markedly decrease, and vaccination numbers increase across our state, and know that we're safe, and that there isn't another variant coming on board. So if you have any questions, let me know, and Mike is here to talk to.
Dr. Hirsch, do you have any comments?
I don't have much to add. I thought that was a terrific presentation that Dr. Castile did, and it really had an influence on our Board of Health, making its recommendations on the emergency orders that the city manager and I had issued about September 9th. The only thing I would make a comment about is, you know, we are seeing that the tide might be starting to recede a little bit, and I'm sure that folks that are listening into this or that will watch this on recordings later will say, well, if the numbers are receding, why are we masking up? Just as Dr. Castile said, in May 29th, when we opened everything up again and we declared an end to the emergency orders on June 15th, we underestimated what Delta was going to do over the summer. And I think it has had a natural propensity, looking at the numbers from India, looking at the numbers from the UK, to kind of fizzle out after about 3 to 4 months. But we don't know what follows. We don't know if the Mu variant or the Lambda variant or any of these other variants will take over, or whether we really will have a hiatus between the next outbreak. But we are in a situation where there's going to be a lot of family gatherings, whether it's over the Columbus Day holiday, the Halloween holiday, and then of course the big ones, Thanksgiving and Christmas. And last year, that's when we saw our big surge, bigger than the one that initially hit us in the spring of 2020. So I think we just have to keep our foot on the pedal and not let up our guard yet. And we just have to see the numbers on the ground. Everybody wants to know, what are we going to do for Halloween? What are we going to do for Thanksgiving? And I think it all depends on the level of community spread and the case numbers. The case numbers, 10 consecutive weeks from July 2nd until September 10th, continue to rise. And then the last 3 weeks, they have receded here in Worcester County. We're down a total of about 24% over the last 14 days in Worcester County. But just like Dr. Castile said, this virus doesn't respect the Burns Bridge and the boundaries that we write for where Shrewsbury is and where Worcester is. People in your community travel everywhere. People in Worcester are coming to your community, and we have worse numbers than you, and we're bringing potentially problems to you. So I'm very proud of the fact that Shrewsbury has had such a great rate of vaccination, but it's not enough to protect you when we have so much other community spread going on in the region. So I would just say we have to continue to be vigilant. We know from last winter, when we didn't have vaccinations, that masks did a very, very good job in helping us tamp down and lower the curve, just as Dr. Castile's slides showed. And I think we have to continue in that mode until we see a consistent, and I mean by that at least 3 months of diminishing cases and increasing vaccination numbers.
Okay, thank you. Dr. Abraham, did you have a question?
Yes, so thank you, Mr. Chair. So Dr. Castile and Dr. Hirsch, just adding on my infectious disease hat and saying, I think 2 additional rationale for why you're requesting is, one, that Delta has been shown to be increasingly transmissible compared to other prior strains. And number 2, as colder weather ensues, more people are likely to be indoors than outdoors, thereby increasing the risk that we may not be able to distance and we may not be able to prevent transmission, airborne transmission, to the points you just alluded to. So I just want to clarify for purposes of this board that clearly there is a rationale, and you've eloquently outlined it, both of you, in terms of why there's a rationale for masking indoors. But your specific ask is that this be an enforceable action. That is correct, because we have already, as a board, recommended that be strongly encouraged. But I think you're recommending one step further, which is an enforceable action, so that there is some surveillance around ongoing masking, and that there is some sort of enforcement action which follows people who refuse to comply. Is that a fair assessment of your sentiment?
Yeah, I think we would like to see this as a policy rather than a recommendation. And that would, I think, help make it enforceable and more likely to be complied with.
Got it. Thank you.
Okay, I see. Jenny Fishman, do you have a question?
I do. Thank you, Chair. Is there a time frame for these proposed recommendations? Not recommendations, but policies.
Well, I think we would need to at least give, and that's what we did in Worcester, a period of about 3 to 5 days for people to absorb the policy, prepare for it. If you're a retail outlet and you want to be kind and provide masks for those folks that show up unmasked, that you can just grab a mask, have the right signage in front of these outlets to say mask required. So you want to give a little leeway, but I don't think you need to give a ton of leeway because a lot of people already have these signs in their windows, and also a lot of folks are walking around with masks. So,
I guess just to clarify, I think my question was really how long should we have these policies in place? Are you thinking until the spring, like we get through the winter months, or because there's no dates on these, so I'm just curious.
We left it open ended in Worcester because I think, as Dr. Castile pointed out, we don't know what's coming down the pike. Is there another variant? Is there a change, as Dr. Abraham suggested? Once we all go indoors, will we see another blip going up? So we left it open ended. I think that if we see consistent numbers suggesting them in December or August, that as December or January, that the spread is really diminished and the case numbers are low, I think we have to revisit this. We have to be flexible.
Thank you.
And I was just going to say the same thing, that it seems like it's something, assuming we put it in place, would be to basically follow the case numbers, the hospitalizations, and the data. And if we do see a significant reduction, then we can consider the rescission of the orders. I see in the orders have a line where there's a rescission box to sign also. So when the time comes. And I also do want to thank you both, Dr. Hirsch and Castile, for your input. I think I take your advice very seriously, and I think it's something we really need to, seriously consider. So unless there are any other questions from the board? No? Okay.
No questions, Mr. Chair.
So at this time,
I'd be happy to move to adopt the policy as recommended.
okay, so Dr. Abraham has moved the requirement for face coverings in all indoor private common spaces in the workplace and indoor private spaces open to the public as adjusted to make it Shrewsbury specific. Do I have a second?
I second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, Steve Vigent, aye. So the order is adopted. We also have, on the next item on the agenda, is to consider two other orders that Worcester has put forth. One, to require face coverings in all schools, public, private, parochial, and charter. I don't think Shrewsbury has any charter schools.
No charter schools.
I see that Karen Clark has raised her hand. Hi, Karen.
Hi. Thank you, Mr. Chairman. Before you move on, though, with the other two for discussion, did you want to pick an effective date for that mask order?
Yes. Oh, thank you very much, Karen. That was something that I was thinking about. And we kind of touched on with Dr. Hirsch already,
Right.
in terms of, my thought on this was to allow like some reasonable time period over which people could be informed and adjust to it and get to know what's going on. I was thinking maybe sometime early next week, Monday or Tuesday, and I don't know what the other board members think.
Completely supportive, Mr. Chair.
Yep, I support that too. Monday is a holiday, so I just want to keep that in mind in terms of the communication with folks.
So maybe
So we could do the 12th.
Tuesday the 12th.
Works perfectly.
Okay, so the board, I don't know if we need to take a vote on this or not, Karen. What do you think?
I don't think you need to, but it doesn't hurt. Because it wasn't part of the original motion, so.
That's true. So do I have a motion to
Yes.
adopt an effective date of the mask requirement to October 12th?
Yes, Mr. Chair, move it.
And
Do I have a second?
I second.
Okay, all in favor signify by saying aye. Dr. Abraham,
Aye.
Jenny Fishman,
Aye.
myself, aye. So we're adopted the effective date of October 12th for the mask requirement. Okay, now getting back to the other two emergency orders, the one for schools. I don't think Shrewsbury has any charter schools. Is that right, Kerry?
Correct.
Or
There are not any charter schools in Shrewsbury. Thank
or
you.
John Wensky, I should ask you.
Yeah, no, that's fine. Yeah, she is correct. Yep. There are no charter schools.
Okay, and the other one is to require employers to report COVID-19 cases in the workplace. Is there any further discussion on this? I believe that the mask requirement in schools is consistent with what the school department is already doing. Is that correct, Mr. Wensky?
Yes, I believe it is. I just had a couple of comments and maybe just a question for the group.
Sure.
As you know, Shrewsbury Public Schools is actually currently operating under two mask mandates. One, the school committee passed on August 18th, and the other one through the Department of Education, I think at the end of August, which was going until October 1st, and it was extended to November 1st. Obviously, I recognize mask mandate within the town of Shrewsbury Board of Health would supersede these mandates, even though I think ours could be maybe stricter if we needed it to be. But I guess, and it sounds like maybe Dr. Hirsch answered this question with regards to the metric that you might follow to relax that mandate, if at all, or if you're just going to look at, kind of the case counts moving forward. Because I know, just for example, Department of Education said that they would lift the mask mandate with 80% or more vaccination within a specific town. So I didn't know if there was a specific metric maybe that Worcester's following.
I don't think that was for the town. I think that was for the school. If 80%
Okay.
or more of the students and
Of
staff.
the student, maybe, yeah, maybe I.
But my question would be, how do you verify that?
Right.
You know?
That's the big question mark. Yeah. Yep.
So as we just discussed, I think we would have to wait and see where the metrics go. As you said, Mr. Wensky, that I think the Shrewsbury Board of Health order would supersede anything else in terms of the other orders being rescinded. So I think we would have to wait and see at what the Worcester Division of Public Health comes up with in terms of metrics that they feel comfortable with for the orders. And as I understand it, the other West Boylston has already adopted these orders, and I assume the other towns are considering them also. Is that right?
Mr. Chairman, which order are you talking about?
All three of them.
So West Boylston and Worcester to date are the alliance communities that have done the mask mandate town or municipal wide. Worcester Public Schools had adopted a mask mandate, and then the Board of Health ratified Dr. Hirsch's emergency order for all parochial, private, and public schools. That was ratified last Monday night. I don't know if West Boylston, where they are with that process. And I believe that Worcester is still the only alliance community that's requesting or requiring, I should say, businesses to report COVID positive employees. We think that is critical so that we can do proper contact tracing and a deep clean if it warrants it, depending on where it is, a restaurant and so forth. But we believe very strongly that all three of these are really important mitigation tools to be able to just try to reduce the spread of the virus.
Okay, great. Thank you, Karen.
Sure.
Are there any other questions from the board?
Mr. Chair, as Mr. Wensky pointed out, again, I think the duration of the order could be contingent on the rate of vaccination among school staff and students and on overall prevalence rates, etc. So while the date wouldn't be specified at this point in time, it would be subject to review depending on current trends, much as we've done with the masking order. And so it could always be modified at any point in time.
Okay, thank you. Okay, if there's no more discussion. Oh, Dr. Abraham, go ahead.
No, I'm sorry. I didn't mean to interrupt you. I was going to say I'll make a motion to accept both the other orders that you alluded to.
Okay, so I have a motion from Dr. Abraham to acquire face coverings in all schools, public, private, parochial, K through 12, and to require employers to report COVID-19 cases in the workplace. Do I have a second?
I second.
All in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself? Aye. So the other two orders are adopted. Do we need to address effective date for these also?
Mhm.
I guess, Karen, would it make sense to be consistent with the general indoor masking?
Yeah, I think that would make sense. We're going to work with, I'm sure the town manager's office and the Board of Health office, et cetera, just to give people notice, through the distribution list so they can post signs and let their staff know their policies, and also, if schools need to order masks and so forth. I think that would be a week out. I think that's appropriate.
Okay, so let's do that.
Do we need to take a vote on that? If so, I'll move that they both be effective October 12th, Tuesday.
Okay, do I have a second?
I second it.
All in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself? Aye. Okay, so the effective date for the other two orders will also be October 12th. Okay, now the next item on the agenda is just our next regular Board of Health meeting scheduled for October 22nd. Unless there's any question or comment, I see no reason to change that, so.
No reason, Mr. Chair.
Okay, any other comments, discussion from anybody?
Motion to adjourn,
Mr.
Mr.
Chair?
Chair.
Yes.
Okay.
I just wanted to thank the board for being consistent with our Central Mass Regional Public Health Alliance. It's really encouraging to know that we're pulling the oars together. And I also wanted to give a special shout out first to Dr. Castile, because I think she made the presentation very crystal clear, and I'm sure she'd be willing to share this if you have a town website that you want to put this on, because that way the public might gain from that knowledge and not be as likely to call in as frequently as they do to Karen and Dr. Castile and I in Worcester.
That's a great suggestion.
Yeah. And the last thing I wanted to give a shout out is to Dr. Abraham, who has really been such an important part of the think tank for at least my work in the region, because I get to dial him up and on a call that we do together. We did it weekly for a long time. Now it's monthly. But he's a rock star, and you're so fortunate to have him on the board, and we're so fortunate to have him in the area.
I second that.
It's absolutely true. Thank you, Dr. Hirsch.
Thank you.
Thank you.
Okay, if there's nothing else, do I have a motion to adjourn?
So
I'll motion to adjourn.
I'll second it.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. Okay, this meeting is adjourned. Thank you, everyone, for your participation. It was really helpful.
Thank
Thanks,
you.
everybody.
Thank
Yeah, thank
Thank
you.
Thank
you.